here. Bring this all the way there, let that drop down. So we're just looking at your arc. That looks nice and clean. Let's go to the other side. And as you go here, definitely it flattens. Nice and slowly bring your knee and elbow to come. We're gonna look at your rotation. So we're gonna stay here for about a minute to 90 seconds. Releasing this, resetting. With your head, you kind of pull, and you should feel a nice stretch all through here.
Cool.
Let's go with that. Let's see how your body responds.
Okay.
A lot of times you see chiropractors giving adjustments, and you see a montage like we just showed you. On the second half of this video, we're going to go into assessment and figure out why we're adjusting, where we're adjusting, and so you have a better understanding of what we do as chiropractors. I hope you find this valuable and educational. If you like it, click like and subscribe. I'll see you on the next video. Hi, Veronica.
Hi.
Good to see you. How you been?
I'm good.
Been
How
good?
are you?
I've been well.
Good.
It's been a little while since you've been in here, almost about a year now. I know you've been busy with your little girl and CrossFit. What are we focusing on today?
Well, I have like two issues. I mean, left lower back. It's never really healed, if you will. Like, it's more managing it.
Yeah.
And, yeah, every so now again, I'll have like a flare up.
Yeah.
Mostly when I lift like really heavy in the snatch and the clean. So that's been bothering me. And then like this new thing, like in between, right over here, like to the right. It's like really deep in there. Yeah, like a little lower. Yeah, in there. And it's just like this is affects me more than the low back because it doesn't go away.
It doesn't go away.
Like all day I feel it back there. Like I just want to shove something in it.
Yeah.
Yeah.
Have you been using some mobility balls or foam rollers? What have you been
Yeah, so I foam roll them a little bit, and then I've been using a lacrosse ball in that little area.
So upper back, lower back. Anything else? I know you had some shoulder stuff a long time ago. Is that
Shoulder's good.
Shoulder's good?
Yeah.
Okay. So we're focusing on the right kind of rhomboid area, left low back. I think it was like your L4 that you've been having. Now, did you ever get MRIs of that?
Yes.
Yeah, so a little disc bulge?
No, nothing.
Nothing.
Nothing showed up.
All right.
Yeah.
Nothing showed up on that. And last time we saw some asymmetries and stuff. So let's do a little assessment, do a little range of motion, maybe some muscle tests, see where your body's at, and get a baseline, and then go from there and figure out how to help you out. Let's do a little assessment. Let's have you stand up. Good. Arms up towards the ceiling. So that looks good. Let's arch back. Look up towards your hands as you arch back. We're trying to get this in front of the toes and this in behind the heels. So arch back. I'm going to guide you just a little. Bring this here, right through here. Okay. Now, as you go back, does it feel tight as you go back or not too bad?
It feels tight on the upper half.
On the upper half?
Yeah, not on the lower half.
Not on the lower half.
Yeah.
Let's do a forward fold. So as we come here, we're just gonna look at the asymmetries. And definitely on this side, it's a little raised up. So definitely wanna get in there.
Definitely feel that.
Yeah. Come back up. Okay, let's do a little rotation. So we're gonna twist to your left. So we should see 45 on the hips and then another 45 here. So that's good. Any difficulty at end range?
Yeah, it's tight on
It's
the
tight.
upper half.
On the upper half?
Yeah.
Now as you go here, we should see 45 and another 45. Any pain with that?
Just tight. Like
Just tight.
Right in that area.
Right.
Yeah.
All right, take this arm up. We're gonna slide this arm down. We're gonna do a lateral flexion. So we're just looking at your arc. That looks nice and clean. Let's go to the other side. And as you go here, definitely it flattens in this little area. So go back up. So we're looking at this arc, pretty good arc. And then let's go to the other side. And then right here, just right after you get past it, then it compensates for that. It's not terrible. Let's see if the neck's involved with what's going on here. So let's just bring your chin down. Now, are you able to touch all the way? So full functional is being able to get that chin to touch. Good. Bring it back up. Now, does that pull on this area?
I don't know.
Yeah.
I don't think so.
Now bring your head back up. Let's go this here. Now we're going to touch mid-clavicle. So you got full range. Now does that? Okay, good. Go to the other side. Chin down. Does that start to pull? I'm gonna just take your chin, go a little further. Does that start to pull through here? Not too bad?
No.
Okay, good. So your neck doesn't seem to be involved with this. It's more when you're moving here that we're getting some things. So that's a positive. One positive. Shoulder range motion, 180, 180. All right, great.
Okay.
So let's take you right here. We're gonna go into a plank position.
Okay.
So we're going into plank, tuck the chin, good. And then just draw your belly button here, good. Nice and strong, we're gonna try to push you over, good. Now, let's slowly drop your knees down to the earth, good. Put your feet flat, and now slowly drop this down go into like a sphinx. You might need to move your elbows a little further. We're gonna go into an extension, so go all the way into extension. So great, your extension looks great. You got tremendous range here, so that's good. Now does it, with a little pass pressure, does that irritate them here or not too bad?
It just feels like I want you to keep.
Okay, now we're gonna go into 8-point plank. So tuck the toes. You're gonna keep the knees on the ground.
Okay.
Good. And then you're gonna tuck the chin, press through the elbows, start to broaden here. Press through the knees and bring this up. Engage here, really try to hold that lower abdominal right there. Now as you do that, you feel the core working?
Yep.
Yeah, you have great extension and then just always making sure that keeping the lower abdominal engaged. Let's go into your hands and knees. Let's just check bird dog. Okay, so we're gonna go opposite leg out. Good. We're gonna go thumb up just to give clearance on that shoulder. Now you're using a lot of traps, so let's pull this right there, good. And then again right here, yes, let's keep that right there. Excellent. Now nice and slowly bring your knee and elbow to come. We're gonna look at your rotation and try to touch and hold. Good. All right, let's go to the other side. And then try, yeah, good. I like that, I like that. And then let's go elbow, knee to touch. So we're getting rotation with a flexion, hold. Good, and then bring that out. So good range, set that down. Now let's just do a cat-cow and kind of see how your scapulas are moving. Good, and then round, exhale, look towards your belly button between the legs. Yeah, a little raised here. And then drop it back down. And then you don't really go into too much extension here. You have awesome extension here, but we want to increase here because right here, let's say about T6 down to T10, that could be affecting what's going on here.
Okay.
So I'm just going to go through some muscle tests.
Okay.
See how all the muscles are engaged. Let's bend this knee. This is the rectus femoris. Push into this hand. Push, 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 push. Good. Let's go over to the other rectus femoris. Hold on. Push into here. 5, 4, 3, 2, 1. Solid. Hold here. This is your psoas. Push up towards the ceiling. No, it's pretty good. Push. And then push one more time. Good. Push up. If it's getting weaker every time I do it, then, and then go again. Yeah, push. It's active, but then as I keep doing it, it shouldn't fatigue out that fast, but it's working a lot. So psoas goes, connects here, goes up here, dives in deep into the low back. Now this is the right side, which a lot of times with your low back, it's on the left, right?
Yeah.
Yeah, it's on the left. So there's some compensation going on. Let's have your left face down. Feet are even in position 1. Position 2 looks good. And then when I go into extension, a little maybe tightness. I would like your heels to be able to touch your glutes, but as we go, some resistance, and then on this actually left side here, this kind of pops up as I go into that pass pressure. Yeah, so you do a slight rotation this way as your quads and psoas start to get a little stretch. So I'm just going to take this, good mobility. Nothing too major. Let's start with a little pressure point work through here. Let's see if we get any like referral patterns. So I'm just gonna dive in.
What's a referral pattern?
Well, when it's it can either like flower out from this region or it can like travel into your hip. So seeing where there's like a referral. So we're gonna go 1, 2, and 3. I definitely feel 3 a little more. It's a little more wiry right there. What do you feel compared to 1, 2, and 3? Yeah,
Not too bad.
I'm going pretty light.
Yes.
Yeah, so we're gonna slowly go a little deeper. And then when I get up into these, are you feeling it more in the upper extensors up through here or not too bad?
Not too bad.
And let's compare this side. So we're gonna come up here, we're gonna go 1, 2, and 3. Yeah, so as I climb up, definitely these extensors are a little more wound up.
So usually, like, I don't know if your pressure is different, but my problems are on the left, but it feels tighter on the right when you're pushing in.
Yeah, definitely through here. So these could be compensating for that left side, and so they could be tighter. You're maybe overusing them a little more. Yeah, so all through here. Yeah, take a deep breath in through the nose. Hold for 4, 3, 2, 1. Let it go. So now we're going to come into the rhomboids where you've been feeling it right. And a little below it where you pointed to, but we're going to get right into those rhomboids. And have you been feeling it on just this side or on both sides?
Just this side.
Okay. I feel like I'm just going pretty medium to light. I know you like deeper, so I'm going to slowly go deeper. If the pressure gets too much, just let me know. Woo! Yeah, right there. Deep breath in, expand, and let it all go. So we're gonna stay here for about 1 minute to 90 seconds, releasing this, resetting. So, deep breath in, and then let it go. Inhale one more time, and then let it go. That moved nice.
Yeah, it did. I was actually kind of scared, but that was a nice one.
All right, let's have you lie face up. Let's get on that psoas on the front side, clear that out,
Okay.
and then adjust your low back. This shortens the muscle.
Okay.
And then we're gonna go in deep through here. So psoas comes through here, take a deep breath in. I'm just gonna sink down into that. Yeah. And then push again. And then relax. Push in again. And then relax. Yeah, so right through there. Deep breath in.
Maybe go that way.
And exhale. Yeah. We're just gonna work this. And now slowly lift your toes up and then slide that heel out. We're gonna slowly just kind of traction. Now now that we've just kind of hit those pressure points, we're just gonna kind of recalibrate that.
Okay.
Just kind of do a little hip rotation. Good range. All right, let's give you a little low back adjustment.
Okay.
So we're gonna get here. Now your L5 look good. 4 actually looks really good.
Ooh, really good.
But your L3 needs a little more rotation. So we're gonna try to come through here, bring this all the way there, let that drop down. Deep breath in, exhale. Beautiful. We're gonna bend the knees. We're gonna do what's called an anterior dorsal.
Okay.
Deep breath in. Exhale. Good. Let's have you stand up. Let's go arms up towards the ceiling. Head down. Interlock your fingers, put them on top of the hips. Elbows down. There you go. Move around, see what you're noticing.
Like, I mean, there's nothing in here. Like, I don't feel anything, but I can totally feel it up here.
Up through there.
Yeah, it's just like, oh, maybe it's just the massaging.
Yeah.
Yeah.
Now, we did release it through there, so we're gonna kind of see how your body just like responds to that.
Mm-hmm.
Doesn't necessarily mean it's gonna take the pain right away, but if we can stimulate some healing response where your body's gonna come in and now that's in a little better position and we got some motion and movement, it's gonna kind of trigger a little healing response. Let's have you lie face down on this. So first we're just gonna put a little lotion here. And just go up and down, kind of open this up, get some blood flow. So, with this adjustment, we're going to traction down, lift up your head again, we're going to bring it over to the side. Let's try that one more time. Bring your head down. Pin this down, lift up your head, bring it over. There we go. How'd that feel?
Oh, great.
We're gonna come over to the other side. First, we're just gonna traction, kind of see where your range is. Good. Now lift up your head, bring it over here. And just a little. Woo! Nice.
Good.
Yeah. The other side moved a lot more.
Yeah.
And this is the side where you kind of have that.
Yeah.
So we're getting that T1, T2, also that C7. So we're just gonna use a little activator, get right on these joints. Do little micro adjustments. We're gonna hit a couple acupressure points along the scapula, rotate the cuff. All right, good. This is kind of the start position.
Mm-hmm.
Now with you like to use that extension, so we're gonna have you come forward, and the tendency is just to people arch back here.
Mm-hmm.
I want you to engage this lower abdominal and really control it as you go forward, not to go into that extension there. So first, you're gonna go forward and bring it forward. Raise your arm up, and now you're gonna rotate here. You're gonna take this, reach over your head right there. Good. And so as you're doing that, with your head, you kind of pull, and you should feel a nice stretch all through here. Where do you feel that as you're coming through?
Right here.
Yeah.
Yeah. Is
Good.
that right?
Yeah, that's your psoas. Good. So as you're here now, what I want you to do, push your knee into the ground, like you're driving it into the ground to really activate it.
Yeah.
For 5, 4, 3, 2, 1, and then relax and stretch a little further. Rotate, lateral flex. Now drive the knee into the ground again to activate it. 5, 4, 3, 2, 1, and then slowly relax and see if your body can give you a little further range of motion. Good. So that's gonna give you your homework to open up this. Of course, do it on the other side, but do it probably twice as many times on this side
Oh, really?
as the other, as you're kind of working on that psoas.
Oh, yeah. I feel that.
Yeah. Now, what are you doing to strengthen this area? Are you doing rows as well?
Mm-hmm.
Okay. So I'm not going to go over that stuff, but I would like to see how you are pulling. So, kind of ready position. We're going to actually turn here. So you're going to be going into a little angle as you're doing it. And I really want you to focus on that, not having this shoulder kind of migrate forward. So let me show you right here. So as you're going, a lot of people, as they pull, the shoulder goes forward. So we want to make sure your scapula and everything is holding, and then slow going through there. And then hold 1, 2, 4, 3, 2, 1. So let's do that on the right side. Let's see how you're doing. So we're gonna face this way, so we're getting a little more of an angle.
Okay.
Okay, and then let's see it. All right. See how that shoulder is kind of here? I want this more here. Good. And really pull from here. See how far that goes forward? Put your hand right here so you can feel when it migrates forward. So slowly go forward and then pull. Yeah, so let's drop it even further so we can just really easily get that. Even though you can go that distance, I want you to stop maybe at this distance right here.
Okay.
Otherwise you travel too far forward. And then go, really pull and stop right there.
Oh, here.
Yeah.
Here.
And then go forward again. So really focus on this here. And then pull. That's better.
Here.
Yeah. And then 4, 3, 2, 1. And then pull. And we slowly go. Yeah. Excellent. If you keep doing it how you're doing it, you're gonna run into problems with that shoulder and getting some impingement there. You can use dumbbells. Switch it up though, I would say.
No.
Different stimulus would be good.
Okay.
And now the other one I want you to do is we're just gonna open up to a T and just slowly go back down. Feel your feet. Good. Arms stay straight the whole time. And then go forward. And then really focus right on that rhomboid where you've been feeling it. 5, 4, 3, 2, 1. Slow go. 4, 3, 2, 1. Good. And then pull. Good. Hold. And then slowly go. 4, 3, 2, 1. Try to keep this as much neutral as possible. One more. Good. So those would be good to kind of target that area.
Okay.
Single arm is good. You can do double arm as well. So if you're not doing single arm,
Okay.
you're gonna crisscross them. Ready position, belly button in, and you're gonna pull, hold. 1, 2, 4, 3, 2, 1. That's how you do that. Hold, and then slowly go. Yeah. And then pull, hold right there. Good. And then slowly go. 4, 3. So very concentrating on control, and then we're just looking at symmetry. And just slowly go. 4, 3, 2, 1. Last one, best one. Feel your feet, feel your core, hold there. And then slowly go. Nice. Good. So things are moving
That looks
good.
okay.
Yeah, that looks good. I'm gonna add that maybe to a warm-up.
Okay.
Just show you some lightweight. Get those muscles kind of fired before you start.
Cool.
Let's go with that. Let's see how your body responds.
Okay.
You might be a little sore because it's been a long time since we've adjusted you. So some soreness for the first 24 hours to be expected. Hopefully not too much. I didn't go too deep because we already gave you some big adjustments, and
Yeah.
so I don't. Even though you want it, like me to like strip that out, we can do that probably next time.
Okay.
Let's just see how it responds there, and then go from there. So let's see you next week and go from there. Sound good?
Yes.
Any questions before I let you go?
So I should wait like a week to get any type of massage.
Let's go get you some deep tissue massage and see how that works. So I'll set you up with that.
Cool.
Okay, cool.
Thank you.
All right. Well, good. Good job. You adjusted great.
Thanks.
Good muscle
Good
work.
job.
Yeah.